day starts off with morning report. The pastor reads from the Bible, then the staff discuss what they've read. After announcements are made, the non-medical staff leave to start the day's work. But before the doctor can start rounds, the nurses on call the previous night give a medical report on how each of the hospitalized patients is doing.
This is a 16-year-old girl who has a pelvic abscess. She, perhaps she might have had a botched abortion or just developed spontaneously from typhoid fever with the perforation in her bowel. But regardless, she has a huge abscess like this in her abdomen, and we're going to take her to the OR today to try to find out what exactly is there and remove the abscess, drain the abscess.
Rounds start in the emergency room, where patients needing the most attention are kept. This little girl, however, is doing much better and will soon be moved to pediatrics. Next stop, maternity, where all pregnant cases are kept, regardless of whether or not they've had their baby.
Cosa è limone? Articular space is preserved, there's no compression. Cavity, that's right. You can just hear it. He had a CNS infection with coccidiosis.
This man is well on the road to recovery. What he needs most now, Dr. Harvey explains to his wife, is food. While some of the wards have private rooms, most of the wards just have 6 beds in one large room. The men's ward is one of the open ones. As you can see, all 6 beds are full. And next up is the men's surgery ward.
This is how bad he is at tuberculosis of the spine.
Women in Congo work exceedingly hard to keep their children fed, clothed, and to keep their households running smoothly. They deserve that bed rest. And so it's here that Dr. Harvey finishes rounding on his patients. This tractor is what provides electricity for the operator, and it's not starting. After a long time of working on it, the tractor finally started. The culprit? Palm nuts were clogging the engine.
Hey, I gotta get changed.
Now that the tractor is up and running, the OR can have lights. Next, Dr. Harvey goes back to his office to do some consultations. This poor old man came in holding a pan into which his catheter emptied. He had already been to the government hospital where they tried to pull it out, but to no avail. Needless to say, it took a while to get it out. After a brief meeting with the hospital administrator, Rachel Moret, it's back to work. After a long and very tiring day of work, Dr. Harvey is finally ready to go home.